Thank you, Jim. Let me first say that I think the tenet in medicine is primum non nocere, first do no harm. And I think we need to understand that every time we are, as technologists, get into the healthcare field. I think Dr. Levin mentioned the genome and the proteome, or our proteins. Let me give you a context in terms of size. So a finished genomic data set is about 1 terabyte. It's about 1 million gigabytes. A finished proteomic data set, which he mentioned correctly, we really don't know how many proteins we have actually today. It's, some people say million, some people say 2, maybe 5, we don't know. It's a new field. It's about an exabyte. That is 1 million terabytes. Wow. So each of us humans carry about a finished data set about an exabyte. Wow. So that's a context that I'm trying to lay before we go forward. Yeah, humans are the big data set. Okay. If nothing else in this program, we are walking big data sets. Okay. Okay. So I'll try and make the future into 2 different sections. The first is about 2 to 7 years, and the next is about 7 to 14, if you will, in a 7-year increment. So the first part is, I think Captain Wiener and Dr. Frisma, Dr. Levin have mentioned the Health Information Exchange, the HIE. Right. Today, there are about 3 HIEs in our country, Massachusetts, along the I-90 corridor, actually, Utah, and my home state of Washington, which is the most recent one. We need all 26 of the projects that are in play to happen as soon as possible. Okay. That actually, in my view, builds what I call the community cloud, and the Blue Button project was mentioned. This is where data exchange becomes easy, and this is the narrow waste of information. Adoption of the Blue Dot project, again, from a community perspective, accelerating that. And I look at, again, molecular diagnostics, or MDX as the acronym is called, and pharmacogenomics. Captain Wiener mentioned the easiest thing in genomics is to figure out, what are the adverse reactions, for example. Right. Are we giving too much dosage? Is it the toxicity correct or not? For personalized medicine. In the 7 to 14-year horizon, I would say the issue is training. We need to train our physicians, we need to train our clinical geneticists to understand what this data means, first of all, and how do you tell the patient what that means.
And a culture shift for them, because they're going to be delivering medicine a lot different than they do today.
And finally, I think in that time frame, the public cloud adoption, I believe, is feasible. Cool. So with that,
all right, very good.